Hi everyone, welcome back. Today we are going to discuss Norma Lateralis and the features of the skull from the lateral view. We see the bones that contributes in the formation of the Norma Lateralis. We shall begin with the coronate process of the mandible. In the human anatomy, the coronate process came from the Greek word, like a crew. It is a thin triangular eminence that is flattened from side to side. It is convex from the anterior aspect and continues with the anterior border of the ramus. The function of the coronate process is to act like a bony buttress, as it prevents the posterior dislocation of the mandible and also provides the insertion site for the temporalis muscle that arises from the temporal bone. Next, we have the temporal bone. Temporal bone have two main parts, squamous part and the mastoid part. First, we will discuss the squamous part of the temporal bone. Squamous part of the temporal bone is the anterior superior aspect of the temporal bone. It consists of two surfaces and two borders. Two surfaces includes cerebral and temporal, and the two borders consist of parietal and sphenoid bone. Right next to the sphenoid part of the temporal bone, we have mastoid part of the temporal bone. Mastoid part of the temporal bone is a posterior lateral aspect of the temporal bone. It has two surfaces and two borders. Two surfaces includes internal surface and external surface, and the two borders include parietal area of the bone and the occipital area of the bone. Mastoid process of the temporal bone has its own clinical importance. Mastoid process consists of the air cells. It also regulates the air pressure and possibly protects the temporal bone during the trauma. The mastoid process of the temporal bone also gives rise to different muscles like sternocleidomastoid muscle, splenius capitis muscle, longus musculi muscle, and the posterior belly of the digastric muscle. Then we have the acoustic meatus. External acoustic meatus is a tubular passageway found in each temporal bone at the anterior aspect of the mastoid process. Together with the auricle, these acoustic meatus detect the sound waves and directed them to the tympanic membrane. However, it does not allow the human ear to hear some frequencies like infrared and ultrasound. So next we have the mastoid process. It's a conical projection that lies at the base of the mastoid area. The interesting and the important clinical fact about the mastoid process is that the infection from the inner ear spread to the mastoid process leads to mastoiditis or the inner ear infection, which we also called as acute otitis media. So now we have the styloid process of the temporal bone. It's just a cylindrical, needle-like projection. It's clinically very important as the elongation of the styloid process or the calcification of the styloid ligament causes the neck and the inner ear pain that leads to Eager syndrome. Okay, we studied the styloid process of the temporal bone. Now we are going to study the tympanic part of the temporal bone. Tympanic part of the temporal bone is a curved plate that provides the attachment for the tympanic membrane, and it also accommodates the parotid gland. Then we have the temporal process of the zygomatic bone. It lies at the posterior aspect of the zygomatic bone, and it also provides origin site for the masseter muscle and the temporalis muscle. Right next to the temporal process of the zygomatic bone, we have infraorbital foramina. Infraorbital foramina is a small opening that lies at the floor of the eye socket anterior to the maxilla. Infraorbital foramina consist of the infraorbital canal that allows the passageway of infraorbital nerve, infraorbital artery, and the infraorbital vein. Beside the infraorbital foramina, we have another foramina known as zygomaticofacial foramina. This is a small, thin, round opening at the lateral aspect of the zygomatic bone. It allows the passageway of zygomatic artery and zygomatic nerve. So at the end, we have the greater wing of sphenoid bone. Greater wing of sphenoid bone, also known as ala magnae. These are two irregular large bones at the lateral aspect of the sphenoid bone. It consists of two important openings, foramen rotundum and foramen ovale. Foramen rotundum allows the passageway of maxillary nerve, and the foramen ovale allows the passageway of mandibular nerve, imaginary nerve, and the lateral petrosal nerve. So that's all for Norma Lateralis along with its clinical importance. So don't forget to like, subscribe, and share this.